Okay, so we were in the posterior part. Ulnar, আমি দেখিয়ে দিয়েছি upper subscapular, lower subscapular nerve, nerve to latissimus dorsi, axillary nerve, and the radial nerve. Supplies are already written: subscapularis, subscapularis teres major. Nerve to latissimus dorsi is also known as thoracodorsal nerve. Latissimus dorsi ke supply করছে, so that's already stated. Axillary nerve, deltoid, and the teres minor. Radial nerve in the radial of the spiral groove. Posterior radial nerve details discussion. Musculocutaneous detailed discussion. Bolbo. Medial pectoral nerve. Pectoralis minor and major. Then we have, that is M for U. U ulnar nerve. Medial root of the median nerve. Medial cutaneous nerve of the arm. Medial cutaneous nerve of the forearm and the supplies. Right. এবার আমি দুটো ইনজুরি বলবো, একটা হচ্ছে আর্বস পলসে, দিস ইজ দি আর্বস পয়েন্ট, এই যে দেখতে পাচ্ছি 6 নার্ভস, 2 ফ্রম C5 C6 সাইকো, সরি এটা দেখানো হয়নি, সো সরি, 2 ফ্রম C5 and C6, C5 and C6, 2 from upper trunk and 2 from division. That is your arbs point. I hope it's clear. Upper trunk injury, C5 C6 injury hole, axillary nerve, musculocutaneous nerve, axillary nerve, deltoid will be injured, adducted shoulder, মানে বেশি পরিমাণ adduction হয়ে যাবে। ওকে, musculocutaneous nerve ক্ষেত্রে biceps brachialis, coracobrachialis, extended elbow, pronated forearm, adducted shoulder. This, every of this together is known as a policeman's, waiter's, or the porter's step hand. Coracobrachialis is not injured because C7 is fair. এখানে শুধু C5 আর C6 দেখছি, C7 নয়। Then the clump case paralysis, C8 and T1 ulnar median nerve, intrinsic muscles of the hand এ যারা সাপ্লাই করছে, এটা একটু ডিটেলসে পড়বো যখন টোটাল claw hand, flexion of the interphalangeal joint and the extension, এই যে এই হাত আমার, extension of the metacarpophalangeal, flexion of the interphalangeal, so the total claw hand, ulnar median nerve দুটো involved. Sympathetic root T1 এ যদি ড্যামেজ হয় তাহলে Horner's syndrome, drooping of eyelids, small pupil, and nose sweating or anhidrosis. More details in physiology will be discussed later when we read autonomic nervous system. And injury to the long thoracic nerve supplying serratus anterior boxus muscle, bending of scapula, which holds the medial border of the scapula along with rib cage and protrusion of the scapula. So that's all about your brachial plexus. So there would be either a classical question on brachial plexus, short note, তখন আমাকে ডায়াগ্রামটার জন্য 1.5, writing all the roots and everything 3 marks. So I say you the 4 marks already, as in 3 or 4 marks মতন, and if it's a 6 marks short note, so 4 plus 1 5, and half of 1 mark will be there for the clinical approach. ঠিক আছে? So axillary nerve, origin from the posterior root is C5 C6. Axillary nerve, axillary nerve posterior, আমি এখানে যে ট্রেস করেছি C5 C6 থেকে কি করে আসছে সেটা আমি দেখিয়েছি যে এভাবে। So it's actually from C5 C6, though it's a part of the C7 as well. ওই permutation combination করে, that will not be a question of course, but still for the information I have highlighted the part. So that's all about it. You can read the mnemonics, and would like to know that if you require the PDF of this note, I will pin it in the comments section, but I feel that taking notes simultaneously, though I haven't shown much of it, the writing is already done, I have just explained. So if you want the notes, you can just pin it down below in the comment section. I'm going to provide you with a PDF of this. That's it for the brachial plexus. Please look at the diagram, it's wonderful. And just open the Netter's Atlas once, it's wonderful there. Okay, so that would be it for today's class. Thank you everyone. So that was your class 2 anatomy, superior extremity, the brachial plexus. Thank you everyone.